Hey everybody. We wanted to let you know about a special Facebook Live that we're doing on Monday night, looking at knee pain and what you can do to help fix your knee pain for good. And so there's two tests that I want you to try before we have this class, because it's going to show you some things that you may not know that were there that may be leading to your knee pain. One of our big kind of points that we try to point out with patients that have chronic knee issues is that it doesn't really come from the knee most of the time. It's usually a lack of strength at the hip and often mobility at the ankle. It's usually one of those two things. So we're going to kind of look at a hip issue today and kind of give you two tests that you can compare at. So first of all is looking at the glute strength. And a real easy way to test this is to have yourself lay face down, and then you're going to have a friend push down on a raised leg and test the strength of that glute. So it just looks like this. I'm going to have this young lady just raise her leg up here for me, and I'm going to try to push down on the back of her thigh, and I'm going to have her just hold it against me. And if she can do that under relatively good amount of strength, that's a good test. We'll make sure we compare both sides. And as you can imagine, most of the time you'll see that there's going to be a weakness on the side that the person often has knee problems. So that's something that we can kind of look for. Another one is going to be a tightness of the hip flexor. So I'm going to have her lay on her back here for this one. And the hip flexor is a muscle that can really get stiff and tight when you're sitting, when you're driving. If you've had any old back injuries, hip flexors can become a big problem. And so a good test to see how the long your hip flexor is. In this case, we're going to bring her left knee up to her chest. We're going to let her hold it really nice and strong, tight there. And then we're going to look at the length of the right hip flexor. So in this position, she actually does really well. She actually has a fair bit of length in her right hip flexor. It's keeping her leg in pretty much the same position as it was. But in most people, or a lot of people, what will happen is this right leg will kind of come up as she's bringing her left knee to her chest. So the reason for that is the psoas muscle, also known as one of the muscles that are found in the hip flexor, becomes very stiff and very rigid. And again, this happens a lot because we sit and we drive and we become very sedentary people. And these two things play together. When the hip flexor is tight, the glute is often very weak. Kind of like if your bicep is tight, your tricep is going to be weak. And so this is a common hip dysfunction or a hip imbalance that we see with a lot of people who suffer not just with hip pain, but they also have back pain. And in the context of our class on Monday night, knee pain. And so it's a pattern that we look for in just about every patient who has any problems from the waist down. So those are two tests that you can do at home. And again, we look forward to you maybe joining us at Monday night on the 11th here at 7:30. Thanks a lot.